Alright guys, so I'm going to talk about my master's thesis today, and it boiled down, it comes to detecting patterns in vaccine efficacy with GIS. And so I'm going to break all this down into like its tiny bits, and so this is going to be a big review for most of you, but that's how it's going to be. So what is GIS, right? So how many of you have used GIS? Right? GIS stands for Geographical Information Systems. It's awesome that most of you have used it. And this is a big change because, as Roger Tomlinson, the father of GIS, said when it was first created, that the early days of GIS were very lonely and no one really knew what it meant. And so it's great that now most people use it, most people have literacy in it, but we're still going to review it. So geographical information systems, they're used to visualize, question, analyze, and interpret data to understand relationships, patterns, and trends. And that's Esri's definition. Esri is kind of the big company that is spearheading most of the innovations in GIS today. And if we look at what a GIS does, it uses different layers. So these data slices, you can layer imagery, elevation, you can add boundaries, you can have your states, your counties, your cities. And by doing that, you can add your own data and then look at relationships about proximity or what's around affecting certain things. So it's a really useful tool for understanding relationships that might be affecting your own data or where your data is. So GIS and public health, how do those intersect, right? So this should be a really familiar map to most people. This is John Snow's map of cholera in London. It was kind of the first application of GIS and public health. And you can see that these little red squares, the longer they are, the more instances of cholera there was. And these are the locations of the wells. So if you imagine this in that layered format, we have the wells, and then we have a layer of London on top, and then we have a layer of these cholera incidences. And he noticed that, hey, this Broad Street well, there's a lot of cholera around here. There might be something going on. So GIS can lead us to further investigate things that we notice. So public health agencies at large have kind of called for more GIS to be incorporated into some of their studies so that they can analyze things from a spatial perspective. And this is particularly true in vaccination fields. So this is the vaccination rates by state in the 2013-2014 school year for kindergartners. We can see that, you know, Colorado has extremely, like, the lowest rates of child vaccination in the country. And we could ask questions like, why is that, right? What's going on with that? So, moving further, understanding vaccine efficacy with GIS. So, vaccine efficacy is defined as the % reduction in disease incidences in a vaccinated group when compared to an unvaccinated group of individuals. So when we're using GIS, we might ask certain questions such as, why is there higher vaccine efficacy rates in certain places compared to others? And also, why are they clustered in certain areas? And so this is an example of Dr. Root's work here in the department of vaccine efficacy. And this is a location of a hospital, and you can see as you go further away, vaccine efficacy actually increases. So you can ask, why is that happening? What's going on here? So that's what I'm looking to do. So then we get to, why is this important? Why is this relevant? Why do we care? We're fortunate enough to live in a country where vaccines are readily available. But in most developing countries, it's really costly and it's a lot of time invested to get widespread vaccinations. And so you have children dying of things that we don't worry about. We don't worry about most of our, like a large population of our children dying from pneumonia, right? But in developing countries, that's a real issue. So using GIS, we can see the populations that need to be targeted with vaccinations to help increase their rates. And then we can also decide, hey, if this population gets more vaccinations, is that going to add to, let's say, herd immunity, right? So herd immunity is when there's like people around you have vaccinations, so more people are protected from it. So if we can target these populations that would see a really overall better health outcome with vaccinations and increase their herd immunity, we might like overall affect the entire population in a less costly manner and in a more time-effective manner. So that's what I'm looking at, guys.
I'm surprised that Colorado